Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to I can't speak. We're going to be covering Parkinson's disease. And I know it's been a while since you've seen me. I've seen the comments, the emails, the DMs. So those who are new to my channel, I take the summers off. June, July, August, I am not working. I'm not really producing content because I'm trying to be outside living my best life with my family. So anything that I produce is just considered a bonus because I really try not to do too much during the summer. I'm really trying to execute self-care because that brain needs to be intact during all the other months so I can produce quality content for you. So we're going to be going over Parkinson's disease. Be sure to check out my website, nexusnursinginstitute.com. There you'll find audio lessons. If you're a current student and you're really struggling, you got to do really, really well on your next exam. I've got audio lessons available for you. You can also book for next generation NCLEX review, a one-on-one tutoring session, or even a consultation session. Now, like I said, I'm on vacay until September, but you can book for September or onwards. You can find me across all the other social media platforms, TikTok, Instagram, Facebook, and of course, YouTube. My handle's the same everywhere, Nexus Nursing. So be sure to check it out. And without any further ado, guys, let's get started. Parkinson's disease. First question, type in your answer, guys. Parkinson's disease is a degenerative disease caused by depletion of what? Lack of what causes Parkinson's disease? Type in your answers. If you were not able to join the live, go ahead and let me back up. If you were not able to join us on the Kahoot, just type in your answers on the live. You guys are doing great. What's your answer? Dopamine. Dopamine is the correct answer. So depletion of dopamine, that's what causes this degenerative progressive disorder that we know as Parkinson's disease. Let me see what other answers you guys had up here. Iron, brain cells, vitamin D, myelin. Myelin, you're thinking of multiple sclerosis, lack of nerves, oxygen. Okay. All right. Let's keep going. All right. Order the symptoms of Parkinson's disease from earliest to latest. Put it in order, guys. So with your mouse, go ahead and put these symptoms in order. What's the first symptom that the patient is expected to experience versus the last symptom? Now, while you're putting this in order, I'm going to remind you, because I know you already know. I'm just going to remind you what Parkinson's disease is. So yes, it's a depletion of dopamine. It's an imbalance of dopamine and acetylcholine. But what happens is it causes these neuromuscular deficiencies in the patient. Okay, and safety is a very big issue when it comes to the patient with Parkinson's disease. All right, you guys on the live, I see you know your stuff. Most of you are right. Order of symptoms from earliest to late. Only 25 of you guys got this correct. So let's talk about it. On the live, most of you guys got it correct. Tremors. The first symptom we expect the patient to experience is tremors. And so what happens, the first person to usually notice the tremors is going to be the patient themselves, not someone else, right? So they'll have the tremors. And then from tremors, rigidity of muscle movement. And then bradykinesia. Kinesia means movement. Brady means slow. So slow movement. And then remember I told you this disorder is progressive. The word progressive, that means as time goes on, it only gets worse. So when I say progressive in the medically speaking, that's what I'm talking about. As time goes on, it gets worse. So they'll go from slow movement to akinesia. When you see a in front of a word, a means without, kinesia means movement. So they'll go from slow or sluggish movement to no movement, like basically they're frozen in place. All right. Again, what's this mostly caused by that lack of dopamine. And so the patient will have TRAP symptoms. I saw this on the live. Whoever typed that, great job. TRAP, TRAP. T stands for tremors. The patients will have tremors. R, rigidity, muscle rigidity. A, akinesia. P, postural instability. And that postural instability is one of the many reasons that this patient's at risk for falls, and they're going to be a safety patient. You're going to be very concerned about safety. Why is a patient with Parkinson's disease a fall risk? Is it because they have a fast gait? Is it because they have a slow gait? Is it because they have a broad-based gait? Or is it because they have a shuffling gait? When it comes to Parkinson's, what makes them the fall risk? Very good. 79% of you got this correct. They have a classic shuffling gait. That shuffling gait, and not only are they shuffling, they're shuffling, their back is stooped over, and the feet is very close to each other. So they're shuffling like this while they're looking down. Have you ever watched a race? When people are running, where are their eyes? Their eyes are looking ahead. They're never looking down. The minute you look down, you lose your sense of balance. Not only are they looking down, because remember, I told you they're kind of hunched over, right? Their posture is kind of like this. Not only are they looking down, which will mess with your sense of balance, because of the shuffling gait and because the feet so close together instead of being far apart, they kind of lose their center of gravity. So that increases their risk for falls. This is something very important to know when it comes to the patient with Parkinson's disease. The code to get in is 3837944. All right, next question. What should the nurse teach the patient about maintaining mobility? Here are your choices. They should sit in a soft, deep chair. They should exercise before going to bed. They should buy clothes with many buttons, or they should rock back and forth to start movement. Out of these options, what should the nurse be teaching the patient about maintaining mobility? We want them moving around. We want them to be active because one of the things we deal with is what? Rigidity, right? Very good. Rock back and forth to start movement, because one of the issues a patient will have, well, even starting movement, they'll have bradykinesia, akinesia, where they have that sluggish, slow movement to the point that they're not moving at all. They're frozen in place, where we want that patient to maintain mobility. We want to maintain that flexibility of the joints. So we want them moving about. So a couple things you can teach a patient. This is one of the examples. Teach them to rock back and forth to kind of get that momentum to start moving. You're going to teach a patient to, let's say you're outside walking the patient, you're on the sidewalk and there are lines. You're going to teach them, you're going to tell them to lift their leg over, lift their foot over that line in order to walk. Or if there's no line, tell them to pretend there's a line. Pretend that there's a line that they need to step over to make them lift up their leg one in front of the other, right? Very good. All right, select all that applies. Which are clinical manifestations of Parkinson's disease? Select all that apply. Clinical manifestations of Parkinson's disease. When I say clinical manifestations, I'm talking about signs and symptoms. And don't forget, how do you treat select all that applies? You treat them as true or false. What do you guys think? Narj, thank you for sharing the live. Thank you. Our choices, I'm sorry, I didn't read it to you. Bradykinesia, monotone speech, akinesia, mask-like facial appearance, tremors, drooling. Those are the options. Bradykinesia, monotone speech, akinesia, mask-like facial appearance, tremors, drooling. Very good. All of these are clinical signs and symptoms of the patient with Parkinson's disease. That slow movement that progresses to no movement where they're frozen in place. So you have the bradykinesia, you have the akinesia. Tremors, remember that's the first symptom that's manifested. Monotone speech and face-like appearance. You won't be able to tell by the words coming out of their mouth or the way they say their words or their facial appearance, if they're happy, if they're sad, if they're entertained, because the voice is monotone and the face is mask-like. And drooling. Another very big safety issue when it comes to the patient with Parkinson's disease. Besides falls, we're also concerned about aspiration. We don't want them choking on their own saliva. Because remember, I told you muscle rigidity. Well, you have muscles in your throat when you swallow, right? It may even be hard for the patient to swallow and they may aspirate. So aspiration is a huge safety concern as well. True or false? The patient with Parkinson's disease should be on a low calorie, low protein, low fiber diet. True or false? Very good. It's false. I want to address the 11 of you that chose true. Okay. I'm going to give you some tips. When you're taking a test and you're not sure, let's say you have a question like this, true or false, and they give you more than one subject, that's actually better for you. And here's why it's better for you. You see how you have 3 subjects? I gave you low calorie, low protein, low fiber. Only one out of those 3 have to be wrong for the whole thing to be wrong. Guys, listen to me. Please believe me when I say this to you. If one tiny portion of your option is incorrect, the whole thing is incorrect. Throw it away. I don't care how beautiful that option looks. If one thing is incorrect, the whole thing is incorrect. Now, I'm going to explain to you why. At the end of the day, you got to remember, you're testing to get your license. The state wants to see if you are safe. If you're going to go out there and kill the test writer's grandma, mom, auntie, uncle, cousin, whatever. So they don't want the nurse that's going to say, oh, well, only the dosage is wrong. Everything else is right. That's fine. No, they want the type of nurse that sees if one tiny little thing is wrong, they're pumping the brakes. That's the type of nurse the state wants to see. And that's how you're supposed to think. Now, as a student, let's say I wasn't sure about low calorie. Let's say I wasn't sure about low protein. Any student nurse, even if you are in the first semester in fundamentals of nursing, one of the first things that you learn is that we love fiber, right? There are very few disorders that the patient is going to be on a low fiber diet. I mean, unless this patient has crazy diarrhea or something like that, we're not going to put them on a low fiber diet. We love fiber because fiber gets rid of all that crap in your GI stream, right? And it really helps get the cholesterol down. It helps you move your bowels. We love fiber. So there are too many conditions where patients going to be on a low fiber diet. So as a nursing student, even if I wasn't sure about the protein or the calorie, I should have said low fiber diet. I'm not going to take the chances. False. Now let's talk about why the patient is going to be on this type of diet. They're not going to be on low. Everything is actually going to be high calorie. Why? What do calories give you? Energy. When a patient is sick, I don't care what the disorder is. If you have to guess, go with high calorie. Don't go with low calorie because calories give you energy. You need energy to fight the disorder. You need energy. And the patient who has Parkinson's disease, remember I told you, they'll go from bradykinesia, slow, sluggish moving, to akinesia, not moving at all. Don't you think that type of patient would need energy? Of course. So they're going to be a high calorie diet. Why would they be high protein? Think about it. Remember I told you the trap symptoms. One of them's what? Rigidity, muscle rigidity. The muscle issue, that's a big problem. What does protein do? Build muscle. Remember, this is a degenerative disorder. So everything that happens is going down the drain. So aren't we going to try to preserve what little muscle we have left? Of course we are. So they're going to be on a high protein diet. And why high fiber? Let me tell you something. Anything that causes a patient to be, guys, I'm sorry, I'm on vacation and I have complete vacation brain. I have to put myself back in teacher brain. What's that word when a patient, what's the word when a patient, like, they're bedbound, they can't move, they're immobile. Thank you. Okay. So when you have a patient that's either immobile or their mobility is very low, you're going to have constipation issues. The more that you move, the more that your peristalsis increases, the more that things move through your bowels. But the slower that you are, your peristalsis slows down and your GI tract just isn't moving the way it normally does. And so the patient tends to get constipated. So any patient, such as a patient with Parkinson's disease, they're going to need lots of fiber, lots of fluid, and lots of ambulation. We want them walking around and moving. So they're going to be on a high calorie, high protein, high fiber diet. All right, which drug would you expect to give to treat tremors and rigidity while stopping the action of acetylcholine? Remember, guys, I told you that one of the issues with Parkinson's is that dopamine and acetylcholine imbalance. So which drug would you expect to treat the tremors and rigidity because of this? Here are your choices: anticholinergics, beta blockers, antibiotics, or antidepressants. What drug class would you expect to give? That's right. Anticholinergics. Look at the other choices. You have beta blockers. Beta blockers are adrenergic antagonists, right? Slows down the blood pressure, slows down heart rate. What does that have to do with the Parkinson's disease? Antibiotic, they kill bacteria, they help with infections. And of course, antidepressants, they treat depression. But when it comes to the rigidity and the tremors that's caused by the action of acetylcholine, you're going to expect to give anticholinergics. All right, which class of antidepressants would you never expect to give a Parkinson's patient? SSRIs, TCAs, MAOIs, or skeletal muscle relaxants. Matter of fact, if you're caring for a patient that has Parkinson's disease and they also have depression, or let's say you just came for a patient with Parkinson's disease, what medication, if that doctor ordered it, you would question it. You would not give that medication. You would pick up the phone and call the healthcare provider and ask them if they lost their minds. Tell them to come give that med because you're not doing it. What drug? Very good. MAOIs. I almost gave you the answer when I was trying to give you an example and I said depression. But yeah, MAOIs. Why? Okay. Patients with Parkinson's disease, very often they'll also have depression because they'll be depressed about this disease. Remember, I told you it's progressive. There's no cure. It only gets worse, right? So very often they're going to be on antidepressants. But let me tell you something about MAOIs. MAOIs are the very last drug class of antidepressants that we're going to give not only a patient with Parkinson's disease, but honestly, anybody. When it comes to MAOIs, those are our last drug of defense for depression. We're going to try everything else first. Why? MAOIs have so many drug-drug interactions, so many drug-food interactions. We give MAOIs when nothing else has worked. So let's look at our first option, SSRIs. SSRIs are actually the first class of antidepressants that are usually given when a patient's depressed. Why? Because it's so effective with the least amount of adverse effects, right? So let's say the patient gets SSRIs, they've been on it for a long time, it's no longer working, we got to try something else. The next class of drugs you most likely see the healthcare provider are going to be your TCAs. TCAs are tricyclic antidepressants, right? Patient's been on that. Now it's no longer working. We've tried all the different drug classes. Finally, MAOIs. But the problem with MAOIs is that Well, there are many problems, many problems. But one of the biggest reasons we're definitely not going to give an MAOI with a patient that's on, with a patient that has Parkinson's disease is the chance of the risk of that patient getting hypertensive crisis, right? Why? That combination of MAOI with levodopa, carbidopa, it just does not go together, and the patient's going to be at risk for hypertensive crisis, which is a medical emergency. We want to avoid that at all costs. Maybe I should have done this Kahoot because I'm on vacation brain. I promise. It's taking me a minute to think, guys. Forgive me. All right. Foods high in blank must be avoided because they block the effects of anti-Parkinsonian drugs. Foods high in what must be avoided because they block the effects of the anti-Parkinsonian drugs. Here's our options: fiber, sodium, potassium, or B6. Fiber, sodium, potassium, or vitamin B6. Foods high in what have to be avoided in the patient that's taking anti-Parkinsonian meds? All right, let's talk about this. I know why 28 of you guys chose potassium. I know why. So let me talk about the wrong answer first, and then we're going to get to the right answer. I'm going to tell you why. You saw potassium, and you know that high potassium, potassium being higher than 5, or low potassium, potassium being less than 3.5, can cause cardiac dysrhythmias, and that is a huge problem. That's a medical emergency. That's true. But is it answering your question? It said foods high in blank must be avoided because I didn't say because it can cause cardiac dysrhythmias. That's not what the question says. It says because they block the effects of anti-Parkinsonian meds. So even though we don't want to give a patient who has Parkinson's disease is taking anti-Parkinsonian meds, we don't want to give them too many foods high in potassium. We don't want to cause them to have cardiac dysrhythmias, but the question's not asking about cardiac dysrhythmias. They're asking about what is going to block the effects of anti-Parkinsonian meds. And let me tell you something, as nursing students, I see you guys make the same mistake all the time. You'll choose an answer based on something you know, but not what the question's asking. Answer the question. So when it comes to types of food that can block the effects of the drugs we're giving to treat Parkinson's disease, the correct answer is vitamin B6. Okay. Why? I don't know. I don't know like the chemical reaction. I couldn't tell you. I just have no clue. But foods high in vitamin B6, such as organ meats, liver, kidney, certain high starch vegetables like potatoes, they are high in vitamin B6, and they can actually block the effects of the anti-Parkinsonian medication. So you got to be careful with that. How are you guys doing on the live? Okay, you learn something new every day. I love it. Okay, last question. Select all that applies. What are the adverse reactions of carbidopa levodopa to be aware of and to assess for? So your patient with Parkinson's is on carbidopa levodopa. What are the adverse reactions we're going to watch out for? Here are your options: heart palpitations, cardiac arrhythmias, dizziness, orthostatic hypotension, fluctuations in vital signs, increased liver enzymes. Now, let me talk to you guys about adverse reactions while you're trying to figure out what your answer is. There is a difference between adverse reaction and side effects. Many books use it interchangeably, but there is a difference. Side effect is something that may possibly happen. You're going to warn the patient it can happen, but we're not going to stop their meds, right? Adverse effect is something that may possibly happen that we do not want to happen under any circumstances. And we warn the patient, if it happens, let us know right away, because the healthcare provider most likely is going to augment that medication. They're going to change the dosage. Maybe they're going to completely change the medication. We don't know, but something's going to change. So that's the difference between side effect and adverse effect. But back to levodopa, carbidopa, levodopa. Adverse effects, all of them. Patient may feel heart palpitations. They need to report it. Cardiac arrhythmias, they need to report it. Dizziness, that's a safety issue. You having dizziness, you can't drive, you can't operate heavy machinery. That needs to be reported. Orthostatic hypotension, what are you going to do? You're going to make sure the patient dangles. on the side of the bed. You're going to sit them up and get them to stand up slowly. You're going to make sure that bed's in lowest position, side rails up. You're going to have the call light within reach. You're going to tell that patient, if you got to get up for any reason, press the call bell because I want to assist you getting up. You don't want that patient to fall on your watch. Fluctuations in vital signs where you'll see maybe the heart rate or the blood pressure go up and down, up and down. And of course, increased liver enzyme. You're going to be checking the labs. You're going to be checking the liver function studies. You're going to be looking at the ALT, AST, right? Yeah. All right, guys. That was it. This was just 10 slides. So I hope you found it to be helpful. Again, those who are new to my channel, I'm on vacation June, July, August. That's why you're not seeing new material from me. Anything you do see between June, July, and August, just take it as a bonus because I'm trying to be outside doing the most. Like I said, I'm traveling with my family. I need to rest my brain. I got to rest my brain. So let's see how you guys did on the Kahoot.